What went wrong? Was the embryo not good enough? How do we know where the blastocyst continued to grow, whether it hatched growing, why it stopped growing? And once we put the embryo back, we don't know why it implants and we don't know why it doesn't implant. When an IVF cycle fails, the patient's heart breaks and the patients demand answers. Why did the cycle fail? What went wrong? Was the embryo not good enough? Was my uterus not good enough? This is actually one of those questions we do not have an answer to. And if you think about it, it's completely logical that we do not have an answer, because when you're putting a microscopic ball of live cells inside a uterus, how do we track its fate? How do we know where the blastocyst continued to grow, whether it hatched, when it hatched, where it implanted, whether it implanted, where it stopped growing, why it stopped growing? But patients aren't happy with truthful answers. They would much rather the doctor made up an answer. And doctors are very happy to make up answers. And they'll make up all kinds of rubbish. Oh, your eggs weren't good. Your sperms weren't good. Your uterus was not good. And the knee-jerk reflex is, then let's do some more tests. Let's do PGS the next time. Let's do an ERA test the next time. Let's do this, that, and the other. Or let's use donor eggs. There is no logical sense to any of these answers. And I think it's important that doctors learn with humility to tell the patients the truth, that once we put the embryo back, we don't know why it implants and we don't know why it doesn't implant. Of course, when patients get pregnant, they don't ask us, why did I get pregnant? They expect to get pregnant. But just like we can't predict who's going to get pregnant, we can't predict who's going to not get pregnant. And we can't provide answers as to why the embryo did implant. Unfortunately, that's the limitation of medical technology and something which doctors need to learn with, and patients need to learn to deal with it too.